Hi, this is Megan from Step Up for Mental Health. I will be taking over this podcast for the next few weeks. To address the various social justice issues that are embedded within American society, I want to take some time to recognize how the field of mental health contributes to the injustices against marginalized communities. Specifically, how it can serve and excuse the prison industrial complex in ways we do not expect. In the next few weeks, we will take time to address social justice issues that pertain to the field of mental health, as well as ways we can advocate for change that will benefit the communities who are disproportionately targeted by the criminal justice system and largely neglected by the field of mental health. Today on Mental Talk, Step Up for Change, I will be discussing how alternative punishments such as probation, house arrest, rehab centers are an extension of the prison industrial complex. These sentencing alternatives are illustrated as a more humane punishment designed to rehabilitate those who do not fit into societal norms for one reason or another. However, many alternatives are designed and implemented as a response to the demand for prison reform. One question I want you to think about during our conversation today is, can you truly reform a system that has been designed to harm and oppress people? Can you reform a system that has been built off of white supremacy, a system that uses its power to uphold white supremacy? This is an inhumane system, historically designed to target and oppress Black and brown people. Can that be reformed? I want to start this podcast by discussing the work and ideas of Maya Chenwar and Victoria Law within their book, Prison by Any Other Name. Their book sheds light on the truth about alternative sentencing and how from an outside perspective we only view these punishments as a positive thing, while in reality these are carefully devised sanctions against marginalized individuals to further the state's control over their lives. The book's introduction began with a personal story from a woman who chose to be incarcerated within her home via electronic monitoring. To her, the decision seemed clear. She would be at home, free to see her children, to be within a more loving environment as opposed to prison. However, once confined to her house, she realized how awful electronic monitoring was. Any step beyond the pre-approved radius of the house had to be submitted and approved by her probation officer. This meant she couldn't even take the trash out. She couldn't care for her children outside the house, could not stop by to see loved ones, couldn't get support from loved ones, couldn't go grocery shopping or run errands or pick up her children from school. Through electronic monitoring, the state was able to lock away this woman within her home while still maintaining control over her life as if she were incarcerated within a prison. Additionally, electronic monitoring did little to address the reason this woman was incarcerated initially. She had struggled with drug use in the past, and to place her within a house with little access to outside resources or even the ability to visit support systems, instead she was isolated from her family, left alone in a situation that creates boredom and negative thoughts. So many brush house arrest as an easy way out in sentencing. But I think we all better understand how isolating our homes can be after experiencing the pandemic. I mean, if we look at mental health statuses of Americans alone during and after the worst of the pandemic and the stay-at-home orders, people's mental health deteriorated. Mental health professionals explain how many more people are dealing with anxiety and depression and other mental health issues, and still are. Therapists and psychiatrists are being overwhelmed not only with the amount of clients they are seeing, but with the severity of each session they are having. While it may not be exactly like electronic monitoring, these experiences can help open our eyes to see how isolating and lonely house arrest can be. In this case, the woman was dealing with withdrawals and detox. She knew that all of her family and friends were gathering for parties while she had to stay home. So we can see how electronic monitoring, a well-supported reform of incarceration, does little to improve the experiences of those incarcerated, within prisons or their own home. In fact, Through electronic monitoring, the prison system continues to ignore the mental well-being of those people. This woman who was fighting against withdrawals explained how the isolation and lack of activity left her with an increased desire for drugs, despite wanting to stay sober. On top of that, she was not allowed to leave her house to look for possible treatment options. As a result of all these obstacles, the woman was rearrested, incarcerated, and separated from her family. Reforms are at the center of discussion when it comes to the criminal justice system. Liberal politicians support and encourage reform after reform for our current legal system. As a result of overcrowded court systems on all levels, as well as a response to the demand for prison reform, we have seen the emergence of various specialty courts. The one I'll be focusing on today is drug court. Drug court often deals with defendants who are being charged with a drug-related charge. Drug court is another tactic to make the criminal legal system seem a bit more humane, sometimes offering rehab as an alternative to prison. I want to point out that even if a person decides rehab instead of an incarceration, which is not always a choice offered, does not mean that rehabilitation is a more humane punishment. In this case, we are still forcing the ideas and social norms onto others, still holding control over the lives and decisions of a particular person. Many people have argued that forced drug rehab does not work and is morally wrong to force upon someone. One of the well-known drawbacks discussed by all who study the criminal legal system is the failure to lower recidivism rate within drug court. Perhaps this is because we are forcing treatment onto people who do not want it, or we are providing temporary treatment that once completed will not be accessible to certain people outside of their sentencing. Substance abuse disorder is by no means something that should be left unnoticed. However, I want to circle back to the recognition that substance, whether it be drugs or alcohol, are sometimes the only coping mechanisms lower income communities have to manage the pain coming from experiences of state violence and systemic racism within our country. To treat a substance abuse problem, which is typically a response to the injustices many marginalized people experience, without giving recognition to the environmental factors that contribute to the disorder, is an injustice in and of itself. On the surface, it would seem that the alternative of rehabilitation would be a far better choice for the community and the individual. The community would get to see those suffering from substance abuse disorder to be transformed into a model citizen, and the individual would be greeted and cared for by staff to help them along their journey of sobriety. However, with any new addition to the criminal legal system, it's important to look at the ways these alternatives are similar to incarceration and allow the state complete control over an individual. Drug court, when offering rehabilitation as an alternative, can range from a choice between rehab or incarceration, or the defendant can be mandated to drug treatment regardless of their consent or objections. In an article titled "Mandatory Treatment for Drug Addiction is Ineffective, Violates United Nations Human Rights Treaty," summarizes the findings of a Boston Medical Center study on the acceptability and efficacy of these mandated treatments across the globe. Within the study, they found that these mandatory treatments around the world were often run by police officers or military officials, had no evidence showing it to be effective, and actually found these methods to lead to, quote, "the complete denial of medical treatment," end quote. These alternatives did little to focus on the treatment of substance abuse and would often house other individuals sentenced for unrelated charges such as sex work, alcohol-specific dependency, which during the study were not a part of the drug treatment programs, but its own category, and even threw homeless individuals in as well. When those incarcerated within a treatment facility in Malaysia were surveyed, over 80% reported craving opioids, suggesting that the treatment did little to address the symptoms of addiction. The article also mentioned the ways mandatory drug treatment can lead to the abuse of those detained. Other studies have reported a variety of abuses ranging from physical labor, physical and sexual abuse, as well as the deterioration of mental well-being within the facilities that were created to promote positive mental health and battle drug addiction. Additionally, mandatory treatment violates the UN treaty that was signed by 160 member countries and states. Mandatory treatment violates the principles that treatment should include informed consent, the choice to withdraw during any point of the treatment process, confidentiality/privacy, non-discrimination in healthcare, and the freedom from inference. The article concludes by offering some possible solutions in replace of the ineffective and potentially harmful practices within mandatory treatment. Similar to many other suggestions from abolitionists and social justice advocates, a more community-based style treatment for those struggling with substance addiction could be helpful for both the community and the individual. Through this, we'd see more accessible treatment options for anyone, regardless of their socioeconomic status, living situation, income, race, gender, sexuality, and other marginalized groups. Additionally, harm reduction has been a topic of discussion and is a rather new practice as well. Harm reduction places the focus of reducing harms rather than the prevention of drugs. This approach uses practices, policies, and programs that aim to reduce harms associated with drug use rather than trying to treat drug addiction itself. This is still a new concept and I'm still learning about it myself. But just because initial studies and evidence has suggested its effectiveness does not mean it can't be twisted into a new form of control. It is important for us to keep a watch on new ideas and practices within the field of mental health to make sure that it is truly helping clients and professionals are using it effectively and with good intentions. While these are great starts, we won't see the change we hope to make in the field of mental health without recognizing the social injustice against marginalized communities. What is truly disturbing is the reality that mental health professionals ignore the way social injustices play a role in the creation of poor mental health among marginalized and oppressed people. Ruth Shim and Sarah Vinson wrote an article titled, "To Achieve Mental Health Equity, Dismantle Social Injustice." Shim and Vinson discuss what their experience is like working within a profession that continually blames marginalized individuals for their poor mental outcomes. Biological determinism, the false narrative that biological and genetic differences occur between different races and ethnicities, alongside with cultural determinism, which states that one's culture and life choices lead to their mental well-being, are being taught within graduate programs. These are harmful practices to be instilled upon mental health professionals like psychiatrists and therapists, who will then carry on the belief that personal choice and biological differences are the root of poor mental well-being among marginalized people. Instead, professionals should be taught about the oppressive nature the United States creates for certain groups of people, which can create and promote poor mental health. Even further than that, the US continually denies access to mental health treatment and resources for marginalized communities, forcing people to cope with the symptoms all on their own. Let's look a little more at the article by Shim and Vinson, as they do a wonderful job at explaining the ways the field of mental health perpetuates social injustices. In the article, Shim and Vinson share an alarming statistic from a survey distributed among the APA. When asked in what ways the American Psychiatric Association reflects institutional racism, the second most common response among psychiatrists was none. It can be hard to understand in what ways your profession is contributing to the oppression of marginalized persons, but by assuming that your profession, one that's purpose is to care for the well-being of its clients, does not benefit from institutional racism and white supremacy, only increases the harm it will do. In this 4-part series, we have discussed how mental health prevalence among homeless and incarcerated populations is a result from debilitating environments, how deinstitutionalization is scapegoated as the lone cause for the prevalence of mental health in these environments, and how mental health services can be twisted into a form of control against incarcerated people. This is merely the beginning of the abuse that is derived from the field of mental health. We can also see how empirical literature continues to victim blame marginalized communities for the impact of oppression, poverty, state-sanctioned violence, and other threats they experience daily. There are many other ways that psychology, academia, psychiatry, social work, and the field of mental health upholds white supremacy and institutional racism. You just have to look around to find it. Shim and Vinson also explain how carelessness towards social injustices only continues to hurt the people psychiatrists are looking to help. The two authors provide a brief story about a tour guide during a trip to Mexico. As a young boy from Mexico, his family and him immigrated to the US. However, his entire time spent in the States resulted in constant worrying and anxiety about deportation. This fear transformed their thoughts, behaviors, and feelings. The constant threat of deportation left this young boy and his family in fear of traffic stops and other encounters with the state. Living in the US was constant terror for his life, resulting in anxiety and mental health problems. His family was deported, which added to increased anxiety and mental health problems on its own. This is the reality for many people who live in the United States. Fear of being arrested, incarcerated, deported, abused, attacked, or even murdered because of the color of their skin. Social injustice is so pervasive within the lives of the people these professionals are serving, that their attempts to treat these individuals is an injustice of itself. When therapy and medication are used to treat patients but do little to improve the environment that is the major source of their mental well-being, these professionals do not care about the mental health of their patients. Their intentions are elsewhere. You cannot claim to support the well-being of all people while ignoring the systemic oppression that is intentionally targeting certain groups of people. If you do not look deep enough to see the ways your profession as a mental health professional benefit from and contribute to this oppression, you are not there to help those who you are currently serving. As the article implies, you cannot care for the mental well-being of others and achieve mental equity without dismantling social injustice. And as I wrap up this podcast, I want to thank all that have listened. I hope you were able to take something away from these discussions. I know I have within the research that I've been doing. I also encourage everyone to continue researching ways that our country perpetuates, creates, and supports white supremacy and the oppression of people of color.